Okay, good morning everyone, and welcome to the Shine Annual Networking Conference. This is our second annual networking conference, and but our very first virtual one. So hopefully all will go well with the technology today. We're just waiting for a few more participants as they join. We're just seeing them all sign in just now. So very warm welcome. I'm Dawn Horton. I'm the network manager for Shine. So on behalf of all of the team, we're delighted to have so many people here today. Obviously, it's a very, very busy time in education. So we're delighted that so many people are able to join us. So the theme today is using health and well-being data effectively in schools to support young people with their mental well-being. It's a critical topic at the moment, given the year that we've just had and still experiencing in 2020. So we're delighted to have this opportunity to share and learn alongside so many health research experts, schools sharing their case studies, and members of the Shine team sharing with the network the developments that we've been working on and looking at how we move forward. So I can see people still joining us, so welcome if you've just signed in. A few housekeeping things this morning before we start with our first presentation. So obviously, this may be different to Zoom if you've used it previously. This is a webinar, so you can see us, but we can't see you. And we will be able to control and share screens and so on throughout the day and keep an eye on everything. So once we have the presentations, we will have a Q&A session at the end of each session. And if you do want to ask any questions, please use the Q&A box, which if you hover the mouse at the bottom of your screen, you'll see the Q&A box and you can just type in any questions there. We'll pick those up. If there are too many questions for the session, you can always email them across to me afterwards, and we'll be able to answer more then. So throughout the day, we've got a wealth of expertise, and it's going to be quite a busy day. So if you have your links in front of you to be able to change, have your program in front of you on your desktop so that you can change from session to session. With the case studies, we have 6, so you'll need to make a choice between the 2 that are running parallel, but we will be recording all the sessions, so you should be able to catch up on any that you miss. Okay, now I can see that we have our full panel, so I'm going to ask my panel if they would like to share their screens now and unmute themselves, and I will be delighted to introduce you. Okay, so very warm welcome this morning to Cathy Richards and Gillian Barclay, who are going to present the first session for us today and start the conference. So the first session is supporting young people with anxiety through using a collaborative approach. We're delighted to have Cathy and Gillian with us today. Cathy is professor and lead clinician and head of psychology at CAMHS in NHS Lothian. Gillian is the deputy principal psychologist at Children's Services in the City of Edinburgh Council. So they bring with them a wealth of expertise and really delighted to have them here with us today. So they'll be presenting for about 20 minutes, and then afterwards we will have time for questions, and I will pick those up from the Q&A box. So Cathy, welcome. Would you like to share your slides?
Yeah, I'll try to do that, certainly. Thank you, Dawn.
Okay. A few minutes to come in, but that
yeah,
be fine. If there's any problems at all, I can share for you.
Yeah, I'm trying, Dawn. It's not.
Let me just double check that you are co-host. And now we have 2 Gillian Barclays. So
yeah, sorry, I'm not sure why.
I'm going to make you co-host as well. Okay, that's sharing now, Cathy.
Right.
So if you'd like to start the PowerPoint. Excellent.
Lovely. Thank you. Thanks, Dawn. Thank you so much for the invitation to be here. Gillian and I are delighted to be here. And we're going to talk to you about the way in which we've used data to inform the implementation of an anxiety management intervention, but kind of how that sits within a broader system, really trying to think about how you translate something from evidence into practice. And I guess the key thing is to say you need a really good team around you, which is why Jill and I are presenting together, because it's something we've done entirely in partnership with each other, but also in partnership with a wide range of other people in education, health and third sector. I want to give particular thanks to the team who produced a lot of the data that I'm presenting today. It's not something I've done most of the work around, or certainly not the data gathering. So I want to say thank you to Gemma, to Jane, to Susie and to Alice, and there have been many other people that have helped us as well along the way. And when Gillian presents her slides, I know she wants to thank some of the people that she's been working with. What we're hoping to do in the next 20 minutes is fairly briefly talk you through our history, I suppose, from where we started thinking about anxiety and thinking about emotionally based school refusal and things that hinder children attending school, how we use the data, where we've got to now. As I've said, we're going to focus on the importance of collaboration and think about the role of implementation science when trying to translate evidence and data into practice. We all know the importance of early intervention, and we know that that was highlighted in the mental health strategy, and that schools have been identified as an ideal avenue for the promotion and prevention of early intervention in terms of supporting young people with their well-being. And in Edinburgh, we had a number of opportunities that kind of informed some of this, enabled us to do some of this work. NHS Education Scotland, NES, provided some resource to all health boards to focus on early intervention, and in Lothian that meant we had around 1.5 clinical psychologists who've been involved in this work. In the City of Edinburgh, Gillian and colleagues worked really hard to work in collaboration with schools to establish the Edinburgh Wellbeing Academy, and Gillian will talk a little bit more about that. And at the same time, we had the opportunity at the Changing School Nurse role, where they had a focus on mental health and wellbeing in children, and were back in schools doing a slightly different role from that they'd done previously, particularly in Lothian. That felt a real opportunity, and we had really good relationships already with the school nurse management team. So, handing over to Gillian.
Hi, morning everyone. So I'm going to try and give you a wee bit of a whistle-stop tour about how some of the information we knew within City of Edinburgh Council in terms of the supports that we offered children and young people, and some of the challenges that we had in our schools informed how we worked together and how we developed a couple of projects in partnership over a number of years, really. And one of the first things I think it's important to point out is that it's very much been a journey, and it's been a journey of looking at what our information tells us about our children and young people's needs, and what that means at a local authority level, and also some of the information we know more at a school level as well. So it's very much been a journey that's been informed by asking questions and endeavouring to find out the answer to those questions, and then think together about how we creatively find solutions that might address the kind of picture that we're seeing emerge. So this is just some of the data that we've had over a number of years, just to give you a wee idea of how we've maybe just taken data that we've already had, but used it in a way to try and ask those questions, answer those questions, and shape the way we go forward. So in I won't read through all of these, but what we've known from our data over a number of years is that issues around about attendance, quite often linked with anxiety, was something that was presenting to a number of our partner services. So educational psychologists were meeting young people where that was a factor. Services like Bernardo's that we work in partnership with. We have an additional support for learning service that were coming across young people who needed individual teaching because they were really anxious about going into school. And obviously child and adolescent mental health services had young people presenting with those needs, often when they were quite far down the line. And we wanted to really act in a way that maybe we could come together, have a really shared message around about that, and also try and prevent things escalating to the point that maybe they needed CAMS in the first place, or certainly just reduce the number of kids that maybe progress to that. So some of our information on that's there. Another bit of information that we had locally was through our application for special school provisions. We knew that a lot of the requests were to do with social, emotional and behavioural needs. And as part of that, often non-attendance was a feature. So we had quite a lot of requests within that. There was a subgroup that were specifically for an independent provision we have in Edinburgh that is specifically targeting children with anxiety and particularly emotionally based school refusal. So we had this picture where we knew that there was this group of young people struggling with their emotions, particularly a subgroup struggling with anxiety, and we had data that showed us this over a number of years. So Cathy, do you want to just go to the next slide? Thanks. So what did we do? We kind of looked at that data and we started a collaborative working group. So this is the first piece of work, and the work kind of all built up over time. And we wanted to develop a shared approach and a shared message around about EBSR, because what we also recognised was that sometimes, depending on who the first point of contact was for a family, they maybe got slightly different steers. And we wanted to just make sure that we had a really clear and consistent steer around about what a pupil support leader in a school might say, what an educational psychologist might say, what somebody from CAMS or a partner service might say. So we got together this collaborative group. One of the things that we did, which was just another bit of data gathering, the first exercise we did was we asked that group how much they felt emotionally based school refusal was a factor in the referrals that they got and the young people they worked with. And it was pretty much unanimous that that was a factor. So we did a really light touch bit of data gathering just as part of that group startup. And and that group then worked together to develop these resources that we now have and share across Edinburgh, resources for schools, parents, adults, and a kind of supporting young persons worksheet resource as well, that all give a very consistent message around about emotionally based school refusal and how we should support it. We launched those, and again we did a light touch evaluation around about that. So there's been a lot of kind of evaluation and data gathering as we've gone along. So we've kept asking the questions, and people felt that they were really, really useful, and we regularly get requests from other local authorities or services asking for those resources. Recently we've made some wee adaptations to that in relation to COVID-19. Just as a follow-on. So that was the first piece of work we did, and I appreciate I'm going through this quite quickly, but I suppose we then kind of asked some more questions, and those questions were around about inclusion. What did we know about what worked for our most vulnerable learners in terms of inclusion? And one of the themes that kept on coming out was that key adults, particularly key adults who weren't teaching staff because they had maybe more time to be adopting kind of relationship-based nurturing approaches with our young people. Those people were often one of the key factors that when we did case studies in our schools, and when we did we did a sort of self-evaluation in a number of our secondary schools. So we took 5 secondary schools and did a supported self-evaluation around inclusion. A key theme that kept emerging through that was that pupil support assistants were really crucial, that there was some challenges around how we skilled them up and how we helped them progress in their career. And that came out, and it also came out in a focus group that we'd done in relation to SEBN needs and kind of how we tried to move towards supporting all our children with social and emotional behavioural needs within their local community schools. So that was a key theme. So that piece of work that we did, the self-evaluation exercise in our secondary schools, alongside some of that work that we'd done around about SEBN and moving towards community-based supports, led to a really exciting piece of work that we've done jointly with CAMHS and our schools. So it's really a partnership between child and adolescent mental health services, psychological services, and any of our schools that opt into the project. So the aim of that, I suppose the other bit of emerging data, I should say, that came out of in a lot of these exercises, was that schools did feel that emotional wellbeing and mental health was something that they could do better on. They were doing their best, but they felt at times a bit overwhelmed, and they didn't have the level of support they would like for those groups of young people. So we came together and we made what we is now called the Wellbeing Academy, but we made a proposal on developing a Wellbeing Academy. And we took some of those things that we'd learned from those self-evaluations, those focus groups, that kind of high-level data gathering that we'd done as a local authority as well. And we put together a plan whereby in Edinburgh we didn't have pupil support officers, we had pupil support assistants. We would develop a post that was a grade higher. It would be targeted. That would be the value it would add, would be that we would target it in a way that those people developed more expertise around about a key area. And because the emerging need that we'd identified was around about emotional wellbeing, that was the target area. It was to enable, another element of it was taking some of the research that other people had done, but also that had come through in our own work around about the really significant role that any key adult can play in terms of making a difference for young people. So we know that there's kind of international and national research that already looks at that, and certainly our local research, that was the theme that was also coming out. We wanted to make sure we developed skills that were evidence-based. So Cathy's going to talk in a lot more detail about the Liam element in a little moment. But the bit that psychological services offered is that we made sure that everyone had a grounding in nurture, everyone had a grounding in solution-focused conversations as two of our evidence-based local approaches. And we also trained people up on things like how they would record contact, how they would think about confidentiality, what it meant to be a key adult. And we also recommended an observational tool that was attachment related. So they were the kind of evidence-based approaches. And we're now on, I think, year 3 of the Wellbeing Academy, and it's been really positively received. And every year we do four days of training. This year it's 8 half days because it's all online, and that felt a bit kinder on people. But we do 4 days of training, and then we do 2 reconnector days throughout the year. That's all about building up the expertise in the area of emotional wellbeing and making sure the PSOs feel supported and that they have adequate skills within their tool belt that they can draw upon. We have done evaluation on our approach to look at whether it has done what we set out to do based on the data that we'd had previously. Cathy will talk about the Liam specific one, but our service has looked at, we've gathered views from pupils, we've done focus groups, we have done supported conversations with the PSOs, so I suppose semi-structured interviews to look at how they've been experiencing the role, and we've spoken to school management. One of the key bits about the Wellbeing Academy was we had already over time been working on the need for everything to be part of a whole school approach to wellbeing, and that's one of the prerequisites to signing up. Sorry, I think I might have just disappeared for a moment, but apologies.
You did, that was scary.
and I think that actually you're probably going to see me run through my house to find a charger once I finish in a wee minute, because that was why. So yeah, the evaluation's been extremely positive on the whole, and Cathy will talk about the very specific evaluation of Liam as well. at this point, the thank yous that Cathy had mentioned are to do with this element of the project. One of the great things about the project from our services point of view is that I've managed to, or we've managed, but I've kind of recommended that it was part of our development plan. So every psychologist in our service will support their schools with this if they sign up. And also we've had a number of our trainees who have helped with things like the focus groups with staff and with pupils. There's too many to mention, but basically it's been a whole service commitment that we've made. Collectively, it's probably I've taken the lead, so it's not taken up massive amounts of time of any other psychologist, but they're just really aware of it. They promote it to their schools, and they're available to the PSOs if the PSOs feel that there's tricky things coming up. So I think that's all my slides, Cathy.
I think so.
And it's a bit of a whistle-stop tour, but I'm aware we don't have much time, so I'm going to let you do the remainder.
Brilliant. Thank you. Thank you. So as Gillian said, we developed the Wellbeing Academy in Edinburgh, and I'm going to focus on some of the Edinburgh data in the delivery of the low intensity anxiety management intervention, which is a specific intervention for anxiety that was delivered in the schools by the pupil support officers, but also by school nurses. So most of this data we've extracted is the Edinburgh data. A little bit might be pan-Lothian because the school nurses have worked across Lothian, but the Wellbeing Academy is just happening in Edinburgh. So again, thinking about data, obviously one source of data we have is research evidence, and we know that a cognitive behavioural approach to anxiety is the evidence-based treatment. We also know from research that this can be delivered by people who are non-mental health specialists, and as Gillian said, we know if people are embedded within the schools, that can build on all sorts of other advantages for the school and for the pupils. So NHS Education work with experts in the field, Paul Stallard being one of those, to develop a 6 to 8 session intervention for anxiety based on CBT. In Lothian, we have worked hard at training people and thinking about how, if we're going to do this, how do we make it stick? I think we've had lots of experience across the services in the past of having good, well-informed ideas that lead to training, but maybe don't make that much difference to what happens day to day. And so what we tried to do was to, again, evaluate our effectiveness using ideas from implementation science. And I think some of the things we are aware of from research, and we had a doctoral trainee psychologist who looked at how effectively, basically evaluated Gillian and myself and other managers, did we do what we said we would do when we said we were going to do this, using an implementation science framework to ask those questions. And we found that the important things were we'd identified an enthusiastic and engaged workforce from the pupil support officers, from the school nurses, and also we've had some people from the sector that have joined in the training as we've gone on. That we delivered good training, but that was followed up by coaching. So we didn't do a kind of hit and run method, but actually we embedded it in practice. We worked with the school management teams to ensure that people were going to, if they engaged with us in this, that they were going to be released to work with young people using this intervention, but also that they would be allowed to attend fortnightly coaching. Again, thinking about the things that have helped this to work, all the referrals for this anxiety intervention for children who have mild symptoms of anxiety are discussed with the coaches, and people think together about whether this is an appropriate intervention for Liam, the anxiety management intervention, or actually whether it's more suitable for something else, or whether it's not anxiety at all. And what we found is, as you'd expect, there's kind of a learning thing where initially schools were really keen to meet the needs of their pupils, and so lots and lots of pupils were referred for this intervention. Some of those were really appropriate, some of those weren't, and there's been lots of communication and sharing with the schools and with the management teams about what this intervention is effective for and what it's not, because it doesn't do everything by any means. It's a fairly specific intervention. the coaching monitors the effectiveness of the cases, and if we need to actually bring in some other supports for the children, that facilitates that. We've also had routine outcome measures as a core part of the intervention. And as Gillian mentioned, there's further training going on. We've trained a lot of people. In Edinburgh, we've trained over 100 people, 116. We've asked them how they found it. They've evaluated the coaching really positively, thinking about how it helps them to apply the fairly dense amount of information we give them in the day's training into their work practice. It's containing when they're anxious or worried about a young person. It helps them to have confidence to try to use this new way of working with young people, and it also prevents drift. We all know that when we go on training, we can come back to it really enthusiastic, but we tend to drift back to treatment as usual or behaviour as usual. And the idea is that this helps people to stay on model. We've used routine outcome measures, as I mentioned. There's a whole suite of measures, but one is the RCADS, which is an anxiety and depression measure, and the other is the YP Core, which is a measure of well-being in children and young people. You may or may not see, but from the graphs, what we found out is that with the data that we've got in terms of pre and post measures, we are demonstrating statistical significance, large effect sizes equivalent to treatment trials, and that when we look at kind of recovery as is defined by some other research studies, again, what we're seeing is a high percentage of children and young people moving from clinical thresholds into non-clinical thresholds. So in terms of the stats, it's good, but in terms of what that actually means to the young people and their ability to get on with their day-to-day lives, it's showing good impact. The young people set themselves goals, so from a kind of more individual basis, we're trying to look at, they set 3 goals at the beginning of the intervention. Do they make progress towards these goals? And again, very kind of encouraging data in that nearly 90% make at least 1 point of improvement towards all of their goals, and 99% improve on at least one of the goals. So we are kind of ticking those boxes in terms of the things the young people want to get from this intervention. Not suggesting that everybody comes out with a kind of, I hit my goal 10 out of 10 at the end of it. That's probably not a realistic expectation, but we're certainly seeing progress from the kind of things that young people are identifying as important. We've also done some qualitative interviews and asked the young people what they like, what they've found. I'll read some of these. It says, it helped me to understand about being anxious and angry. I felt listened to and that they wanted to help me. It helped me take some first steps to get back to band practice. So that kind of clear reflection on what their goal had been, and that it was a series of steps to get there. I got to speak about my worries and they don't stop me anymore. So that's a very lovely thing for us to hear, because that's exactly what we're hoping. We've also asked the staff involved, and we've used a grounded method to evaluate those. I'm going to skip through some of this, but I guess the things that came out as really important was the thing where we started, was that multi-agency working, collaboration across the system. It's been much easier for people to work with pupils where they have a good relationship within the school, particularly for the pupil support officers where they're actually embedded within the school. As Gillian said, the whole school approach is vital. This can't just sit as a kind of little add-on that happens quite separate from everything else that's happening in the school. We've been engaging parents in the delivery, and as we've shared our evaluation, and both on an individual basis, and we do an annual update report which goes out to everybody. The barriers that occur, because I think it's important to recognise this hasn't all been straightforward, is where the project aims and scope aren't known through the system, where the young person's needs are not particularly known, and where there's not really an understanding between those working with the pupil in terms of what's going on. And there's been lots of communication required. So we've met with the senior management team within the schools. We've done twilight sessions to try to refresh what we're trying to do. And we've been communicating about this being an intervention. It's not the intervention. We know we need lots more tools in our toolkit. This is just one of them. We are slightly developing as time goes, and we're delivering we in CAMS had developed some workshops for parents whose children were anxious, and we've been working towards delivering those in school for non-referred, to parents of non-referred children. And we've just taken quite a big step forward during COVID, and developed some online resources to do that. And we've tested the first one fairly recently, which was one of my staff, Gemma, and one of Gillian's staff as an educational psychologist. And we were thinking we were going to deliver it to the clusters around the high school. But I think the opportunity of doing something like this on an online basis gives us perhaps the chance of meeting more parents in one webinar. So we're thinking about that, trying to evaluate that and thinking about what our next steps are. As Gillian said, we worked over the summer in developing some of the anxiety resources to make them more attuned to the particular situation of COVID. And we've recognised that this is just an intervention and it focuses on anxiety, and it's not particularly good for those young people whose mood is low. And working with NHS Scotland, we're about to introduce another intervention into the toolkit, which is behavioural activation. And so our staff will be doing that train the trainer training soon, and then we'll be rolling that out to staff in the Wellbeing Academy. As I mentioned, we're kind of continually reviewing, Liam, and one of the things we have to look at is what helps. Some practitioners are working with lots of children and young people and consistently delivering this intervention. Some do the training and don't do any delivery. Some do the training and only do a tiny bit of delivery. Some attend coaching, some don't. And we're trying to see what helps staff to actually apply this in their day-to-day work situation, and what are the barriers, what stops people doing that. We are also going to have to ask that question just because of capacity, because as we train more and more people, the space for coaching becomes more pressured. We're piloting a group Liam intervention, and we got quite a long way about that before lockdown in a couple of the schools. We'll need to think how we do that in the current context. In CAMS, we're trying some online therapeutic group delivery, so I think once we've had perhaps a little bit more chance to see how that goes, that might be something we could offer in a school context, or support in a school context. As I said, we're hoping to expand the delivery of the anxiety workshop for parents, and we've got this real opportunity with the new school counsellors coming into place. And again, just delighted about the partnership that we have, because Gillian's been very involved in that development, and so that means we've got confidence that this new workforce will work together to build capacity within the schools and across the system, so that we're able to reach those children and young people that need intervention early. So that's all of our slides, very busy slides, sorry about that, but we're really happy to take questions if you would like to ask any questions.
Thank you so much, Gillian and Cathy. That was fantastic timing. I was just about to say 2 minutes and tell you that. And I did realise their apologies to participants. I was so enthusiastic that I started the session a little bit early there. So the good news is it's all been recorded, and you will be able to catch the beginning if you were still trying to get on the session. But huge thanks to Cathy and Gillian. That's a really comprehensive approach to managing anxiety, involving so many different areas of the education system to support young people. So a really impressive piece of work, and I'm sure we have some questions. So I'm going to check the questions. So this is Chris Pope from Tain Royal Academy. And is asking, are there opportunities to be involved with these projects if we're based outside of Edinburgh and Lothian?
So the Wellbeing Academy, I'll leave Gillian to say more about in terms of the anxiety management intervention that NHS Education Scotland have been rolling out across Scotland. There will be people that are engaged in that team in each of the health boards. Your head of psychology in the local CAMS team would know more about that. So there should be local opportunities rather than us trying to kind of jump into an area where we're not actually based or work.
Okay.
In terms of the resources we developed, then we're happy to share them with other local authorities. If they were to be adapted, we'd like to be acknowledged, but they can be used just as they are. So if people do want them, you can email Dawn and I can share what we did. In terms of the Wellbeing Academy, also I'm happy to kind of discuss with my counterparts in other local authorities, because I think it is an approach that could be done in other local authorities, but obviously Edinburgh Psychological Services are supporting Edinburgh schools with it. But I think similar approaches could be done elsewhere, and certainly if a psychological service in another local authority wanted to chat it through with me, I'd be really happy to do that.
That's fantastic, and great to see the sharing has begun, because that's why we're all here today. So I'm sure that will be very popular. And do, obviously, if you have any follow-up to any of these sessions, do get in touch with me. You all have my email address, so I'll be happy to join some dots for everyone. Okay, so another question here from Becky, which is, how can we get this implemented under the current restrictions? So that's an interesting question.
Yeah, I mean, I think that it's a challenge, isn't it, for everybody? We are, as Gillian mentioned, we're moving our training to be online. Our coaching translated actually very readily onto online, either using, in the NHS we use Teams rather than Zoom, but our psychologists have been offering the coaching to the practitioners throughout lockdown, both about their Liam cases, but actually the conversation's often been a bit broader because the context is so different and so challenging for all of us as staff. We are hopeful that as schools are back, that our PSOs, our pupil support officers, will be able to continue to deliver the anxiety intervention in the schools, and we would expect that to happen. And we know and we're seeing from the national surveys that anxiety is very much a flavour of one of the difficulties that children are facing coming back into the school, having been in lockdown. As we've mentioned, we're trying to get better at using the tech and to deliver some of the work for parents on an online basis. The group stuff, I think we're just thinking about, but my hope is that either we'll be able to do that as a face-to-face offer, or we'll do it as an online offer once we get a bit better at doing online groups with children and young people ourselves.
One of the strengths of this whole approach is that it's about key adults being part of the school team. So our PSOs are obviously part of the school team, so they're not visiting services, which is great. So they've not been in Edinburgh. The guidance for people who are part of the school team is very different to a service like Psychological Services, who's going in as a visiting service. So that's been a real strength of this approach. And as Cathy said, schools have been able to appoint PSOs for this run of the training. We've just had about 20 people on the first 4 half days of the initial training, and we're going to do another run before Christmas, because actually this year we've got even more people coming on than we have in previous years for various reasons. So I think that's a really exciting element, that it's not and I suppose the other element of that being part of the school team is that within the job description that we did, there is some flexibility about how the PSO can be shaped to fit what the needs of that school are. So we do have parameters that we ask the schools to work within in terms of protected time for individual work. Like Cathy said, we need to know they can deliver things like Liam, but there is scope within it for them be part of the whole school approaches and the role to be shaped by the needs of the school to some extent.
Can I just ask, actually, it's one of the questions that's come up, what does PSO stand for?
Oh, sorry. It's a pupil support officer. So
pupil support officer.
A bit boring. It should be I think it should have a more exciting name, but pupil support officer. So we have in Edinburgh, we now have, having just had pupil support assistants, we now have pupil support officers. So a lot of our pupil support officers are PSAs, so pupil support assistants, who have evidenced a degree of skill and commitment over a number of years, and then they go for that post, which is a grade above. But we also have had people, we wrote the job description to try and attract people like maybe a psychology graduate who's thinking, what am I going to do? Or people that have had maybe we've got some youth workers that are doing the role. Yeah.
And they've got a well-being focus in that job description. So it's kind of a more specific role maybe than some of the tasks that the pupil support assistant might also be doing.
So that was the kind of rationale for it being agreed above, is that we're skilling them up in a much more targeted way.
Okay, thank you. I'm just keeping an eye on the time at the same time. So there's two more questions rather, to put to you. So a question here from Michelle Fullerton, asking how parents are involved with Liam. So this was mentioned.
So the PSOs or the school nurses, if appropriate, can share information with the parents. Obviously, you have to do all of the normal things around consent and so on, and make sure that they know what's happening so that they can reinforce the work in the home context. And that varies from child to child, but that's something that's part of the model. And when we think about evidence-based treatment for anxiety in children, particularly in the younger ones, we know the role of parents is absolutely vital. So we want to make sure we offer that as an opportunity in this intervention.
Thank you. And very quickly, so we have a question from Pam Steele here. You mentioned resources that you created for schools. What resources did you develop for schools, and are these available to share with other schools?
Jill, do you want to say?
Yes, we have a guide. We have a guide for parents on supporting anxiety related to school. We have a guide for schools, and we have a worksheet that a supporting adult could do to think through some of the things that might help with early anxiety. And yeah, they're the resources that if people want to email you, Dawn, I can send them to you and you can pass them on. And like I said, if people want to adapt them, I can provide Word versions, but we would just ask that we're acknowledged. But actually they're fine, they're not really Edinburgh specific. Actually, there's one document that is, and it was a pathways document, so we tried to map out what you would expect in terms of a staged approach. And that I can also share that, but that one is Edinburgh specific.
Thank you. And so a question here from Steph Murtagh. Is the Liam approach used in a one-to-one capacity or as a group intervention?
Sorry, Liam is a one-to-one intervention, and what we're trying to do, and what we're trying to do nationally, in fact, is adapt it so that we've got a group offer as well. But all of our data and most of the experience nationally has been about delivering 6 to 8 sessions on a one-to-one basis. And in Edinburgh, we're talking about that delivery being by the pupil support officers that we've just described and school nurses primarily.
Okay, and we've still got questions coming in, which is just showing how much interest we're having. So Florence Burke is interested to hear more about the role of the third sector in the partnership and any plans to develop that.
I suppose this is where, because we were speaking about a narrow piece of work, we're not telling the whole story just because we had 20 minutes. We've actually worked really closely right from the beginning with the third sector, as Gillian said, when we developed the resources for schools and for the system around anxiety and how to support pupils who are anxious back to school. We work very closely with a number of third sector partners. We also work with the university as well, which was great because they helped us to make it look much more pretty than we could do within health or education, which was lovely. And also added the rigour and the science that they brought to that conversation. We are certainly in the Liam delivery. So the Liam delivery is something which is an offer within Lothian that is across all of the areas that we work with, so Mid Lothian, East, West Lothian, as well as Edinburgh. And we have trained a number of people from third sector organisations in that delivery, and we've been working closely, particularly with the Lothian Association of Youth Clubs and delivering training through their training network. So lots really, and I think there's lots more opportunity. And as we think about the work that we're doing with the new school counselling workforce, you know, Gillian and I are part of an early intervention group, which has lots of people from health and third sector and education as well. So this is just a little slice of some of the work, I guess, we've been trying to do to build capacity around mental health and wellbeing in children and young people.
Okay,
and I think just, I suppose, just to point out, that it does all sit within our Getting It Right for Every Child approach.
Yeah.
So within that, the Wellbeing Academy and how we deliver Liam in schools will be part of the planning process for children, which also involves our third sector partners. So in Edinburgh, we've got approach to Getting It Right for Every Child, where it would be anything that was done would be seen in the context of who's around that child and family. And by doing that, the third sector is involved. I know that sounds a bit complicated, but it's been developed specifically as an in-house support within schools that they can access, but they would also see it within the GIRFEC planning alongside any partner agencies.
Okay, thank you so much. I'm afraid I am going to have to draw this session to a close. However, the good news is that those who didn't get their questions put across, I've just had confirmation they have been saved, and we will be able to get to those after the session. But that was a fantastic presentation. Thank you so much, Cathy and Gillian, for being with us today. And I hope you're going to stay with us and enjoy the rest of the session. So as we finish our first session, and the internet is working and all is good, I'll just a couple of words then about what's going to happen throughout the day. So I will close down this session in a couple of minutes, and then you'll be able to go back to your programme and find the link for either case study 1 with Fiona Donnelly from Sandwood Primary School, or case study 2 with Andy Dingwall from Blairgowrie High School. So we've got 2 Shine schools who are going to share their case studies. Remember that all the sessions will be recorded, so it's obviously a really difficult choice to choose one or the other, but we hope to make sure that everyone can see everything ultimately. Okay, so without further ado, I will close down this session, and I look forward to seeing you again in the case studies and throughout the day. Okay, thank you.